In emergency medicine, our patients are really our teachers. And in the Memorial Healthcare System, seeing hundreds of thousands of patients through our emergency departments, being one of the largest public healthcare systems in the country, our residents get an opportunity not only to see high acuity and high volume, and that diversity, that spectrum of patient population yields clinically competent physicians that can work in any environment.
We're looking for future residents that are committed to the field of emergency medicine, that want to be highly competent emergency physicians, that want to work hard and want to learn this trade, and that are excited about being the next generation of emergency physicians.
The acuity and the patient volume between our emergency department is astonishing. Level 1 Trauma Center, Memorial Regional, approaches 90,000 high acuity patients. Memorial Hospital West is upwards of 98,000 peds and adults.
Training at Memorial Healthcare System and at Joe DiMaggio Children's Hospital is certainly where you want to be. And at Joe DiMaggio Pediatric Emergency Department, we are the only pediatric level 1 trauma center in South Broward County, and we're certainly the premier institution here down in South Florida. We have an extremely large pediatric ED, a 44-bed ED that sees over 75,000 pediatric patients per year, and our community sites such as Memorial West actually sees up to 20,000 pediatric patients in particular per year.
The residents are not just thrown in to see patients, do procedures, and count the number of cases they have seen. We instill in you to be a doctor, a physician, a community leader that goes beyond the numbers.
In our residency program, we're training physicians to not only be clinically competent, excellent at procedures, resuscitation experts, we're also teaching them to be human beings, bringing that patient-doctor interaction to another level. So what are the patient's needs, their social needs, their cultural needs? We have an Understanding Healthcare series that we run that runs longitudinally throughout residency to incorporate some of these values into these new clinicians.
We take our responsibility super seriously to create the next generation of clinically competent emergency physicians, not only in didactic sessions and simulation laboratories, but at the bedside.
In terms of procedural training and task training, our residents become experts at all procedures in emergency medicine, including central lines, transvenous catheters, surgical airways, just to name a few. And mastering these procedures on Memorial's advanced simulators and high-fidelity mannequins brings to the bedside the skill, the competence, and the confidence that our patients deserve.
When you leave here, you are going to be very, very well trained with the volume, acuity, the patient-centered focus that we have here at the institution, the phenomenal culture that exists, and just being and knowing that you are a part of a larger community, but you're not losing that one-to-one touch. You're going to leave here knowing that you have been properly trained.
We have a full support emergency medicine staff to support the needs of the residents, whatever those non-clinical needs are. And we are very committed to the wellness, the happiness, and the success of our residents in all aspects of their professional and personal lives.
My role is simply just making sure that their experience runs smoothly. The support on wellness, the support on mental health, making sure that our residents are fully acclimated, making sure that they know and have all the tools that they need to become successful.
One of the unique aspects of the Memorial Emergency Medicine Residency Program is that we truly listen, and our learners are also our builders. So we listen and we take feedback from residents, and we actively change the program to make it a perfect fit for them, to make them into the best clinicians they can be.
We're constantly evolving. We're constantly looking for ways to innovate. Our philosophy on teaching is, this is our program. And when residents have ideas and they have thoughts and they want to make the program better or take a different direction, we're 100% supportive and we're 100% behind the innovation. In fact, we empower you to take ownership of your training